Very good evening, friends. Meeting again in the session of Materia Medica. Yesterday, we have finished the natremure and many aspects of the natremure from Allen's keynotes we have discussed. We have finished the remedies which are there in the syllabus of second year from the Allen's keynotes. Remaining 7 remedies which are not there in the Allen's keynotes, we are going to discuss it from Boric's Materia Medica. Today, I am going to share one more remedy, a very important from our practice is the Calcarea Fluor. It is Schussler's 12 tissue remedy also. So, if you go through the 12 tissue remedies book by Schussler, you will get many aspects, the direct action of Calcarea Fluor on the human being, the pathophysiology of Calcarea Fluor, that you are going to learn. Today, I will going to share Calcarea Fluor from Boric's Materia Medica. I will not going to read each and every sentence full of Boric's Materia Medica, but I will teach you what is important from Boric's Materia Medica and what you have to grasp. Because Boric's Materia Medica is the most important clinical Materia Medica which can be used at the bedside. Thing is that you have to understand what is given in first paragraph before the mind. If you are able to catch and grasp and understand, then it is possible to apply the medicines very easily in the patients at the bedside. And for that purpose, I will going to teach you exactly the way you have to look towards the Boric's Materia Medica. Before going to the chapter, I want to share many aspects of this remedy. This remedy is very important remedy in deep vein thrombosis, DVT. I have utilized it successfully and I never failed, but I used to use it in biochemic doses, 6x potency, deep vein thrombosis. Many cases of deep vein thrombosis I have solved with the help of Calcarea Fluor in 6x potency in repeated doses for months together also. Same is true when I have utilized the Calcarea Fluor in varicose, it is associated with deep vein thrombosis. Varicose veins are also one of the important thing in entity where we can use the Calcarea Fluor. So I have utilized that also for the varicose veins, then the deep vein thrombosis. It is part and parcel of every case where I used to find it out the degeneration, specifically at the bony level, because it is the only remedy which has directly a relationship with the osteophyte formation, the exostosis, and this remedy has the capacity to dissolve the exostosis. You use it for in repeated doses in the biochemic doses 6x potency for months, you will find the changes. Cervical spondylosis, the lumbar spondylosis, the lumbar canal stenosis, avascular necrosis of femoral head, then ganglion formations. This is one of the important remedy. Osteoarthritis of the knees, where the osteophytes are developed, Calcarea Fluor is the remedy for it. So, whatever may be the patient's remedy, constitutional, I used to use Calcarea Fluor as an adjuvant in the biochemic doses in such types of cases. And this remedy always hastens the speed of recovery. So, one should not forget Calcarea Fluor in such types of cases. Second thing where I have used this remedy always is the goiter. Hard goiter over there always has a relation with spongia and Calcarea Fluor. Calcarea Fluor, where the swelling is quite hard and patient has a little bit difficulty in swallowing, Calcarea Fluor with whatever may be the patient's remedy works better again in the 6x potency. And last entity where I used to use this remedy is the fibroadenomas of the breast and the fibroids of uterus. Fibroadenomas of breast, I have treated multiple cases of fibroadenomas with the help of this remedy, where the consistency of fibroadenoma is quite hard. The conime is close to it. But Calcarea Fluor is the better remedy to be utilized in repeated doses in biochemic doses, and it has the capacity to dissolve the fibroadenomas. Even in cancerous process, if of CA breast, where the tumor is very hard and stuck to the internal organs, immovable and stony hardness, Calcarea Fluor is again one of the important remedy in that case. So, stony hardness of the glands, characteristic thing. The more and more deposition of the atherosclerosis material on the vessels, Calcarea Fluor is the remedy. Wherever there is exhaustosis and degeneration, Calcarea Fluor is the remedy. So, you have to understand the concept behind the Calcarea Fluor. Fluor is the hardest element. It is the element which is part and parcel of your teeth, and teeth are too hard. Calcarea Fluor, being a calcium itself as a hard and fluor itself as a hard, makes it so hard, and the pathologies which are related with the Calcarea Fluor are always a hard pathology. So if you are able to grasp this, you can use the Calcarea Fluor very commonly in your practice. I used to use it many times in my practice and with very successful results. So this remedy one should not miss, and I will tell you the few important things about it. The first paragraph from the Boric Medica, and thereafter in the particulars, whatever is given in italics and whatever is important, that I will going to teach you. But we have to understand the meaning of each and every sentence in the first paragraph. Then you will grasp the core of the remedy. So let us open your Borix Medica and open the remedy, the Calcarea Fluor, Fluorspar. It is fluoride of lime. A powerful tissue remedy. So that's why it is a 12 tissue remedy. For hard, underline, every word is important. Hard, stony glands. So wherever the glandular affections are there, they are stony hard glands. It is as if they are stones. See, this sentence, if you grasp and observe in patients, don't think of any other remedy. You start Calcarea Fluor in the biochemics. It is a wonderful remedy in stony hardness. The hard stony glands, varicose and enlarged veins. Very important remedy in varicose veins. Even I have used this in varicose veins associated with varicose ulcers, or which are called as stasis ulcers. It is a remedy which has capacity to remove that varicosity, open the channels, and also increase the flow of blood in the part. So it is very good remedy for such a thing. So varicose and enlarged veins and malnutrition of bones. So bones becomes brittle, bones become osteoporotic, and it gets degeneration, producing the exhaustosis, the osteophytes. The Calcarea Fluor never fails. So this is very important. Then go for, there is hard knots in female breasts. Yes, hard knots. This is very important. The fibroadenomas, they might be small in size, they might be big in size, but they are very hard in consistency. They are not always cancers. They are movable. If it is a movable and if you pinch the skin over it, it is always a like fibroadenoma. But this fibroadenoma, if has the characteristic hard consistency, think of the Calcarea Fluor first. So it is very important in specifically in hard knots in female breast. Goiter, yes, that's what I goiter is an enlargement of thyroid. But again, this thyroid gland becomes hard in consistency. The characteristic of the Calcarea Fluor over there is the hardness. Congenital hereditary syphilis, and this is very important part. So the child born with teeth, congenital syphilis. Child born with full of hairs, or all over the body, the hairs are there at the time of birth, definitely a congenital syphilis. It is a presentation of congenital syphilis. And in such types of cases, Calcarea Fluor is the very important remedy. I have treated a case of hemangioma on the face. It was big hemangioma at the time of birth. Hemangioma is a tumor of vascular tissue, and tumor of vascular tissue, Calcarea Fluor is the remedy. I started directly with the Calcarea Fluor because it was they were not accepting to go for operations, so patient was not ready, and I started with Calcarea Fluor. Within span of 2 years, it is as if vanished. Nothing has remained. It is a wonderful remedy for that. So one should not forget in hemangiomas at the time of birth, congenital, this is remedy. Induration threatening suppuration. Induration is the hardness. The swelling, which is hard swelling, is an induration, and induration leading towards the suppuration. See, induration is very hardening of the swelling, and then it is forming the pus inside, leading towards the suppuration. So many times you can use Calcarea Fluor along with the silicia. Many times it helps. It is a very important remedy in such types of cases. Many cases of cataract have undoubtedly been influenced favorably by it. Yes, you can prolong the development of cataract. Cataract is the degeneration. So you can, if you give the Calcarea Fluor in old persons, those who are just started getting the degeneration, and if you continue them on the Calcarea Fluor along with the cinerea drops, it prolongs the cataract formation, it prolongs the degeneration of the lens. So this is again a very important utilization of both the remedies clinically. Congenital syphilis manifesting itself in ulcerations of mouth and throat. So congenital syphilis expressing mouth ulcers, throat ulcers, carries a necrosis with the boring pains and heat in parts. Carries and necrosis in the with the boring pains and heat in the parts. This remedy I am using off and on in the avascular necrosis. It is the remedy. I had a case, it was interesting case. The case was treated by a big homeopath. A child, 7 years, 6, 7 years, was brought to me by a one homeopath. His own son was treated by a big homeopath at Mumbai, and he was having tremendous pain in his femur, left femur, and it was a diagnosed case of osteosarcoma. They have asked, orthopedicians asked them to ampute the leg right from the hip joint, and patient's father was not ready. Then he was taken to homeopath who started, but his pains was not getting reduced, and somehow he came in contact with me and he brought his child to me. This has happened nearly about 10 years back. 10 years back, this case I have started handling, and this fellow, with the help of two remedies, the Calcarea Fluor and silicia, absolutely settled. No further progress of the disease. The pains vanished. The tumor, it is still there, but it becomes benign. It never spread. It never developed. The child who was just going in fixed flexion deformity of knee started walking, and whole knee resolved. Tumor is still there, but not causing any pain, nothing, and he is running, doing all his activities, in taking part in every sports now. Calcarea Fluor made the wonderful progress in that case. Calcarea Fluor and silica, both the remedies I have used. Silica I have used in homeopathy, depending upon his constitution, and Calcarea Fluor for considering that hard tumor in the femur. It was very hard. And that was a wonderful case. I have treated with the, even that this child is still today, he is under my treatment and he is doing very well. Nothing, no problem thereafter in last 10 years with this child. So it is an interesting case. And two more cases I am treating. One case, nearly about 40-45 years of age, the fellow who had a malignant tumor in the femoral head. Around the whole femoral head and neck, there are changes of tumors, and he was asked to resect, but they told that it is very dangerous and risky situation in your case. And same case I have got just one year back. That fellow also I am treating with the same remedy. Calcarea Fluor in both cases made the changes. The first case, in fact, he was cured because I am treating this fellow 45 years, 45 years since last 7-8 years, and he used to come to me for any other complaints. His own main complaint has vanished. His hips are totally free, and he is able to squat. He is able to run. He is able to do all his activities. So this is very important remedy in such types of whenever the bony tumors are there. Calcarea Fluor is very important remedy. So one should not forget the Calcarea Fluor over there. Arteriosclerosis, that's what I have told. Arteriosclerosis, thickening of the blood vessels, arteries. This is very important remedy. Threatened apoplexy. Apoplexy means congestion to the specific part. Threatened apoplexy is congestion to the brain. Threatened म्हणजे होऊ घातलेला. The things which will going to happen is threatened. So this is again a good remedy. Whenever you find that there is threatened apoplexy, one must think about this remedy. Even in tumors, whenever there are tumors in the brain, this is very good remedy. Tuberculosis, important. It is psychosyphilitic. So tuberculosis, this remedy, if there is a, if the tubercular heals with very hardness over there, the think of Calcarea Fluor. Used after operations, the tendency to adhesions is reduced. And again, I recollect one case from the Nandur Shingote. He is the son of a teacher, and he was operated for appendicitis with surgeon. After appendicitis, he developed tremendous adhesions in the abdomen. He started getting pain in abdomen. Again, he was resected. Laparotomy was done. All adhesions resected, and he was recovered thereafter. Again, after 6 months, again he had pain in abdomen. Again, they found the adhesions. Again, he was resected, and then that child was absolutely disturbed because there was no treatment in allopathy to prevent the adhesions in that fellow. So what they can do? So that surgeon referred this case to me. When I started that case, I worked out whole case. He found to be a case of Cilicia again. So I have started with him Cilicia, and along with that Calcarea Fluor I have continued, and that patient had continued treatment for 2 years with me, and thereafter he never had the adhesions, he never had the pain in abdomen. Now it has been nearly about 7-8 years have been passed. Now he is doing job in big company and he has settled. So this is all the features which are mentioned by Boric in this first paragraph defines the precise action of Calcarea Fluor, where there is the role of Calcarea Fluor. Now we'll learn more important symptoms in the further. Mind, the Great Depression, groundless fears of financial ruin, fear of financial ruin, because finance plays a very vital role in the fluor element. Fluoricum and finance, it is closely associated. So there is a fear that they will become poor, there will be loss, financial loss, and that remains in their mind tremendously. Then there is a one important feature in head, hard excrescences on the scalp. So there are hard eruptions on the scalp, this is one remedy. In eyes, whatever is given in italics is very important. Strumous flictanular keratitis. Strumous means affecting the glands, along with glands are affected. Flictanular, where infection is not present, but it is an immune reactions against the bacteria which are present around the eyes and inflammation develops, is a flictanular keratitis. It is the inflammation of cornea. Keratitis inflammation is, it is a corneal inflammation, and corneal inflammation can lead to the corneal ulcer, and whenever corneal ulcer heals, it always produces opacity. To prevent opacity, Calcarea Fluor along with silica always plays the role. If you will open in the same book, Boric Medica, under the silica, he has mentioned the this sentence, this remedy is for keratitis, corneal ulcer with corneal opacities. Use 30th for months. It has been written. Open your book, Silicia, and see the eyes. Definitely it has been written this by Boric. What is the sentence? It should be there in Silicia. Corneal opacities, keratitis, corneal opacities, use 30 for months. And I have treated a case of corneal opacity for used the silicia 30th potency for a year, and he was settled, he recovered. It is a wonderful remedy to dissolve the fibrosis. So we have to take into consideration all those clinical things. What is the sentence? Yes, I mean, iritis, iridochoroiditis, that has been mentioned over there, and he mentioned over there last sentence that after effects of keratitis, ulcers, cornea, clearing the opacity, use the 30th potency for months. And this is the hint given by Boric. You should not miss. Subcutaneous palpebral cyst. So subcutaneous palpebral cyst, which you can see under the chalazion, then this is a very important remedy to dissolve that. Sometimes even recurrent styes, and if stye is hard, think of Calcarea Fluor. In ears, chronic suppuration of middle ear, yes, chronic suppurative otitis media, this is remedy. So it is very close to Silicia, it is very close to Merck. Nose, atrophic rhinitis, very important thing, atrophic rhinitis, especially if the crusts are prominent. Atrophic rhinitis is the where there is atrophy of the nasal mucous membrane, there is sense of smell is lost and crusts are formed. If crusts are hard, think of the Calcarea Fluor. Mouth, very important, induration of the tongue, hardening after inflammation. Carcinoma of the tongue with hard tumor in the tongue, think of Calcarea Fluor always. Very, very important remedy for CA tongue where the tumor is hard enough. Then throat, there is follicular sore throat, plugs of mucus are continually forming in the crypts of tonsils, hypertrophy of Plashakas tonsils. Then stomach, acute indigestion from fatigue and brain fag with much flatulence. So there is a indigestion, then there is a fullness in abdomen, then there are eructations, and it is because of fatigue. Stools, you can get two important features: bleeding hemorrhoids, itching of anus from pinworms. This is very important remedy. Internal and or blind piles. This is again one more important feature. Male hydrocele, induration of the testicles. Very, very, very important remedy. Hydrocele, I have treated left-sided hydrocele with the help of rhododendron. It is very good remedy for that along with Calcarea Fluor. Respiratory, you can get the cases of croup over there. Calcarea Fluor removes the fibroid deposits about the endocardium and restores normal endocardial structure. Underline this. This is very important sentence in your Materia Medica. This has a clinical significance. It has been written by Jones, and this is his clinical interpretation. These hints always helps. Circulatory organs, vascular tumors with dilated blood vessels for varicose and enlarged veins, aneurysms, valvular disease, very, very important remedy. Neck, chronic lumbago, aggravated beginning to move, ameliorated by continued motion like Rustock's, osseous tumors. So that's why it is very good remedy for osteosarcoma. Rachitic enlargement of femur in children, infants. Then extremities, ganglion, encysted tumors, exostosis on fingers, chronic synovitis of knee joints, gouty enlargement of the joints and fingers, very important useful remedy in orthopedic practice. Then sleep doesn't have significance. Skin, the last part is very important. Induration of stony hardness, then swelling and indurated enlargements having their seat in fascia or capsular ligaments of joints. Ganglions, it is a very important remedy. Fistulous ulcers, this is a very important remedy. And then modalities. Worse during rest and changes of weather, better during heat and warm application. It goes close to the stocks in such cases. Relationship, yes, conime, close association because stony hardness of glands. Lepis also having similar stony hardness. Barata Moor is one more remedy where atherosclerosis is present. Hecla lava, bony affections, Hecla lava, it is more on mandibular or maxillary level. Uh, Yes, we'll discuss. We'll finish first remedy and then I will answer. You put your question on in the chat box. Calcarea stibiata acts as a hemostatic and absorptive in uterine myoma. I have not have any reason or I have not utilized this remedy. Mangifera indica, yes, definitely for very important remedy for varicose vein. And last part is the doses. Third to 12th trituration. So he himself, Boric also explains the decimal scale and he has used it in the biochemic remedies, biochemic doses, 6x potency. A chronic remedy needs sometimes before manifesting its effects. Means if there is a tumor with a stony hardness, yes, this is very important remedy. Should not be repeated too frequently. This remedy should not be repeated too frequently. That is very important thing. In centesimals, you should not use it too frequently in centesimals. Yes, you can use it in decimal, definitely you can repeat. In 50 millisimal, you can repeat. But in the centesimals, it is very defecting remedy, should not be repeated often. So, this is a very important remedy from the homeopathic materia medica and most practical remedy in our day-to-day practice. One should not forget this remedy or miss this remedy in practice. If you, my suggestion is that open the Susler's book, read that first part of it up to the general biochemical action. You will learn the detailed aspect of this remedy over there. So this is very important remedy, one should not forget. Yes, there was someone who has raised the hand uh, during conversation. Put your question over there or you can ask it directly if any query is there. So if any queries are there, any questions are there, we'll definitely have a chat. So any query? So this remedy, my suggestion, utilize in your practice. For students, must read the Schussler's 12 tissue remedy book. You can learn a lot about the remedy over there. Tomorrow we'll start with one more remedy, Calcarea sulf from the Boric's Materia Medica because it is not there in Allen's notes. So tomorrow we might miss the lecture. I don't know. If it is possible, it's definitely. If it is not possible, no. Why should we not repeat the remedy in centesimal scale? That is the question asked. Centesimal scale is the most uh, energized medicines, because every time we used to reduce it by 1 by 100 and give the 100 strokes to it. And every time when you put the 100 strokes, the more and more energy is liberated. Most energy potent cases are there. And in such types of potent energies is used in repeated doses, used to produce a harm. It proves more proving of the remedies. In order for that purpose, one should not go for the infinitesimal for repeated doses. Specifically, if the remedy is defecting, you should not repeat it so much. Yes, 50 millisimal you can repeat many times. Dr. Yogesh sir has asked one question. In brain tumor case, can we use? Yes, definitely. I have utilized it, in fact, brain tumor cases also, and it is a very good remedy. Definitely. Wherever the tumors are there, and if they are hard enough, the think of the Calcarea Fluor.
Sir, whether if this remedy is continuously taken, whether warts of any stony hardness it can cure.
If yes, what's but generally what's are not the manifestation of the syphilitic miasm. What is the manifestation of psychotic miasm? But if it has the stony hardness, definitely you can utilize the remedy, because that is the characteristic. Definitely. In varicose veins, if maintaining cause present, then what can do? Entailers. Basically, you have to utilize the auxiliary measures. Ask the patient to go for tiptoe exercises. Second important thing, they should wear the stockings. That is more important, because they cannot stop their work. So, use of stockings is very useful, and you have to tell exactly how they should wear the stockings. There is a method. Generally, what happens? We used to use the stockings like this. It never works. Ask the patient to lie down for at least for 20 minutes, keeping the legs up. And in that same position, he should wear the stockings. Then it works definitely. This is very
Sir,
important thing one must know. One must know all the practical aspects about it. Just use the use of stocking is wrong. You have to tell the patient exactly what he should do. Okay, anything else? So we have good discussion today. So I expect such types of discussions, questions. Is it useful in lumbar? Yes, lumbar spondylosis. Already I have explained it. Lumbar, cervical, every spondylitis, spondylosis, and spinal canal stenosis. Calcarea Fluor is the remedy.
Osteoporosis also it can be used.
Yes, yes. Osteoporosis, it should be utilized along with Calcarea Fos. So Calcarea Fos and Calcarea Fluor both are present in number 26 biocombination. So better to give for biocombination 26 instead of giving two different remedies. 6x, yes, 6x is useful. Always 6x is better. Even Schussler himself have mentioned in his book, better potency to be utilized always is the 6x. That has been said by Schussler. So that's all for today. Tomorrow, if possible, I will let you know. I will take the. I will go for it for the lecture. If it is not tomorrow, day after tomorrow, definitely we'll meet. Okay. Thanks a lot.
Thank you, sir.
Good night.
Good night, sir.